All right, our next presenters are Sadaf, Siddiqi, and Elizabeth Fitzgerald, who will present on dual identity formation among adolescent mothers, and they are mentored by Professor Carissa Chia in the Department of Psychology.
I'm Elizabeth, and this is Sadaf, and we're looking at dual identity formation among adolescent mothers. Some things we're going to go over are our rationale for the study. We're going to look at identity development, both self and maternal identity, correlates of identity development, methods, results, and discussions. Our rationale for the current study, rates have increased since 2005, despite a 14-year decline in teenage pregnancy. And this is very concerning, which is why we're looking into this. There are many negative outcomes of becoming a teenage mom, and for both the mother and for the kid. Both face lower socioeconomic status, lower self-esteem. The mothers face the possibility of an early marriage, as well as an early divorce, as well as there's a harsh and punitive punishment for the child. It's very challenging to develop both a self and maternal identity simultaneously for these girls because they have limited resources and they have to integrate several existing roles into one self-concept. The goals for the present study are to examine the dual identity formation. We were personally interested in whether specific factors were influenced by successful development of either identity, both identities, or neither identity. These outcomes included psychological adjustment, stress, and relationship with the father. Self-identity is the way an individual defines themselves and comes to accept him or herself as a unique entity. Some of the protective factors that we found may decrease the likelihood of negative outcomes among these teenage moms and their children. Some of these moms show that they are not developmentally ready to take on the challenges of motherhood at such a young age. And there's a pretty consistent age with our moms between 12 and 20 years old. Next is maternal identity, and we looked at maternal role attainment, which is a process in which a mother develops her sense of identity as a mother and incorporates this new identity into her already developing self-system or self-identity. We had first-time mothers report strongest identification with the maternal role at 4 months of postpartum. Our children did range, infants from 2 to 8 months, so the variability, we were able to capture that really well. First is psychological adjustment, which we had successful identity formation, instills a sense of purpose, instills a sense of confidence, and overall psychological adjustment among adolescents. Some mothers find it difficult to transition to motherhood, but that this transition eventually helps them form a more stable identity. The next outcome that we looked at was stress. And stressors tend to be higher for adolescent mothers who are pregnant or parenting, which makes it an even harder situation to deal with. Not only do these girls have to take care of themselves, but they also have to think about their new infant and the type of future that they're going to have together. One of the challenges of becoming a new mom is this process interferes with the process of developing a successful identity, and this happens when there's a change in the family structure. The relationship with the parents is the #1 issue that happens. The new mother has to figure out how her relationship with her mother is going to be impacted by the new child. The next outcome that we looked at was relationship with the father. And a positive relationship with the father reduces some stress that is associated with being a new mother. And social support, especially from one's own parents, has been found to serve as a protective factor against a lot of the challenges that adolescent mothers face. Also, the father can reduce stress by providing both emotional and financial support for the new mother. Now our methods, we had 103 first-time moms, and 87.3% were African American, and 56% were enrolled in high school at the time of the study. And 4.5% were Hispanic, 5.5% of our study was white, and 2.7% identified themselves as biracial. Okay, our methods, we're going to start with identity development first, which we looked at, we called it SPRS, and it had 22 items, and an example of a question that they would have to answer would be, some parents often can't figure out what their children need or want, but other parents seem to have a knack for understanding what their child needs or wants, and they would pick which answer most they identified with the most. The next one was Erickson's Psychosocial Inventory Scale. It's a 47-item scale, and there are 6 subscales based on all of Erickson's stages. The order of the measures would be identity, psychological adjustment, and stress. The next one we looked at were psychological adjustment methods. We start with the RIF well-being scale, and that assesses psychological well-being through 6 different dimensions: autonomy, environmental mastery, personal growth, positive relationship with others, purpose in life, and self-acceptance. The ones above here were the subscales that we decided to use for our current study. The next one would be the SLS is what we called it, and it's the satisfaction with life scale. And that is 5 items that assess global life satisfaction. An example of that would be, I judge myself by what I think is important, not by what others think is important. Next, we look at different stressors. We chose to use the hassle scale. And an example of this would be just some daily hassles in life, such concerns about inner conflict that they have, the fact that they might have unchallenging work or school environments. And they would assess the stressors specifically on the frequency and the intensity of the stressors. But in this study specifically, we just looked at the frequency. Next are life events, which there's 42 items, and such life events that they could choose from were pregnancy, death of a close friend or loved one, a major change in their social activity, and they would assess how strongly of these events affected them. We also looked at the parenting event scale, and this is a 20-item scale, and it assessed the frequency of different parenting hassles that these adolescent mothers have to deal with. An example just would be being nagged at, whined to, complained at, and then how frequent these events were occurring, self-reporting for the mother. We also looked at relationship with the father, and those we used the NRI, which is a network of relationship inventory. And an example of this that we found was, how much do you and this person hassle or nag one another? It looks at relationship with the parents, looks at relationship with your best friend, relationship with your partner, as well as the relationship with the fathers of the baby. Another thing we looked at were just some basic demographics: age of the mother, age of the child, household income, and things of those nature. For our basic procedure, we had trained undergrad research assistants who visited the participants in their homes, and after obtaining informed consent, they administered structured questionnaires. Participants were compensated with $20 upon completion of a questionnaire packet.
So for our results section, we divided participants into 4 distinct categories. Those adolescents that associated with both identities were placed into a role duality group. Those that associated with neither identity were placed into the role privation group. Adolescents who associated with one identity were placed either in maternal or self-prioritization group. Adolescent mothers in the role duality group reported significantly higher autonomy or environmental mastery. These findings suggest that mothers who actually were able to achieve role duality may have already had a mature personality And if they're achieving greater autonomy, it may be because they already have developed a mature sense of self. As for reporting environmental mastery, we believe this may be related to a greater overall competence. Increased competence in these girls may actually enhance their ability to manage the stressors of being an adolescent and a parent at the same time. The adolescents in this group also reported lower life events and daily hassles. We think that the autonomy and environmental mastery that you saw in the previous graphs help these mothers cope with the daily stressors that they face, and these could include things like financial instability or transportation difficulties. The next set of graphs are going to be for the self-prioritization groups, and although we expected that the mothers in the role duality group would have the best outcomes, we actually found these findings for this group. These mothers also reported high environmental mastery and autonomy, but they also reported higher positive relationships, self-acceptance, and fewer stressors. These findings suggest that a well-formed identity is associated with positive self-appraisals. So in other words, girls with a mature sense of self are more likely to interpret situations more positively. The self-prioritization group also reported lower parenting stress and daily stress. We believe this could be a result of the additional resources that are available to this group. These adolescents may be able to manage difficulties better because they have the additional resources. To add to this, these mothers reported a more nurturing and affectionate relationship with their fathers. We believe the father figure may provide advice, emotional stability, or just basically assistance with identity development in these mothers. In conclusion, our results demonstrated that the self-prioritization group had the best outcomes. They had greater autonomy, positive relationships, and reported fewer minor stressors. These findings emphasize the importance of having a well-established self-identity in order to reach better outcomes for the future. Just a few comments about our study. We examined developmental processes as they were occurring at the time, but it may be helpful for researchers to examine developmental processes as they occur over a span of time. Also, we examined father involvement on the adolescent's life and development, and future researchers may actually want to examine both the mother and father involvement on the infant and adolescent's development. Finally, our study was based on measures of self-report. It may be helpful for researchers to use quantitative and qualitative measures in the future. We just want to acknowledge Kelly Shepard and Dr. Chia for their mentorship during this process, and also to the research assistants in the Culture, Child, and Adolescent Development Lab for their help with data collection. Questions?
We have time for one question.
I was just wondering, what were some confounding variables you found during the study?
Well, this was part of a larger study, and we had a lot of things that we were assessing. So these mothers had things going on. We didn't look at personal factors that were going on. So I guess other relationships besides the father, the mother, school, education, we didn't look at those for this particular study.